not fair. At a time when working families are already stretched thin, the last thing they need is Washington's chaos driving healthcare costs up even higher. Today, President Trump and congressional Republicans proved that they would rather shut down the government than make Americans' healthcare more affordable. Access to affordable, high-quality healthcare is a basic human right. But right now, millions of low and middle-income Americans are facing a looming healthcare crisis. With Affordable Care Act subsidies set to expire at the end of this year, 20 million Americans could see their premiums skyrocket, paying thousands more for health insurance or losing their coverage altogether. For too many families, the cost will simply be too much to bear. One constituent who reached out to me, Evan, is a musician and a teacher in New York City. He told me that even though he teaches 14 classes, he doesn't qualify for health insurance at his job. Living with a chronic health condition, Evan already pays more than $1,300 a month for coverage under the current system. And while he earns $60,000 a year, he's living paycheck to paycheck and barely making ends meet. Evan reached out because he has nowhere to turn and doesn't know what he'll do if healthcare costs climb any further, which they will under this Republican plan. His story is just one example of the Republican manufactured healthcare crisis that is driving up costs and hurting families across America. That's why I'm calling on my Republican colleagues to end the gridlock and work with Democrats to make healthcare more affordable. This isn't just some abstract line in a government funding bill. It's about preventing a family from having to choose between making rent payments and having health care. It's about helping the working parent who needs ACA subsidies to afford their child's life-saving medication. It's about supporting the small business owner who shouldn't have to sacrifice their own income to offer their employees good health insurance. In the richest country on earth, everyone deserves to have affordable health care. So to my Republican colleagues, let's get back to the negotiating table. Let's reach a deal to reopen the government and protect families from higher healthcare costs. Our constituents are counting on us. Happy to take your questions.
Brian O'Neill, WLEA.
Go ahead, Brian.
On the medical costs for Medicare and Medicaid, the administration and conservative media outlets, et cetera, have talked a lot about how that's not really going to affect anybody except for an illegal immigrant. Your thoughts?
So it's not true. In fact, Republicans claim that the ACA tax credits currently lack sufficient guardrails to prevent fraud, and the evidence for that is non-existent. They are assuming that the Democrat demands for extension of ACA tax credits automatically equate to new spending for undocumented people, and that's not true. Republicans are assuming Democratic demands for overturning Medicaid cuts from the summer's reconciliation bill automatically means that restored Medicaid funds translate to healthcare expenditures for undocumented immigrants. Again, that is not true. Undocumented immigrants are ineligible for Medicaid.
Do you mind if I ask a follow-up question?
Go ahead.
It's sort of a follow-up question anyway. I saw that you put on either Facebook or Twitter that the Trump administration is putting a $100,000 H-1B fee on companies that have foreign doctors.
Right.
Your thoughts on that?
Well, it's just ridiculous. It's ridiculous to, again, be charging more money and hiring costs for employers and workers all across New York.
Thank you.
Senator Jeff Cole.
Senator, this is Holiday Moore with WAER. Can you hear me ask my question?
Go ahead. What's the question?
This is an off-topic question. We have received reports of overcrowding at the ICE detention center up by Buffalo, and are wondering what, if anything, your office is doing to address that, since that is a federal issue rather than a state issue. One of them is saying somebody we've talked to who's very reputable has said that they are detaining people who should not be contained with prisoners, their families.
So I know my state staff is looking into it and trying to get more information, which we will get to you as soon as we have it.
Senator, it's Ron Plants from Channel 2, if you can hear me.
Yep.
Okay, number one, what is your concern as to how long this shutdown would last? Again, as you're aware, everybody's talked about a 2018-19 when 35 days. And what would you say to residents, citizens who are concerned that they are not getting their services? TSA, there could be flight delays. You've heard all these, I'm sure, the ramifications of this. But also, I've got a second part of this. Back last March, you voted to avoid a shutdown. You're not doing it this time. Can you explain the difference?
Yeah. Well, the reason why I'm voting against this budget right now is because the Republicans and Trump are about to do massive tax hikes on our healthcare bills. We are already paying too much for groceries, for housing, for electricity, for insurance. And I know that New Yorkers cannot afford this looming tax hike on their premiums for healthcare. Also, because of the Republican plans that have happened since March, we are seeing massive tariffs that are creating increased costs for all goods that people have to buy. And we're also seeing, because of the Republican plan, millions of people being cut off Medicaid. And so the combination of those rising costs and these looming healthcare increases, I voted no.
Do you fear this could be a long?
What do you think is going to get Democrats and Republicans to the table if the Republicans have not been able to be trusted, in the words of your colleagues?
So to answer, was it Robert's earlier question? I don't know how long this shutdown's going to last. I don't know why the Republican Party want to see these increases in healthcare costs. It's unconscionable. It's going to hurt their constituents as much as it's going to hurt New Yorkers. So I don't know why they're not participating and trying to get these healthcare costs back down. And I don't know what will get them back to the table. I think facts will get them back to the table. I think as these rises in costs happen, they're going to have outcries from their own constituents saying, what are you doing? Why are you raising costs on millions of Americans who can't afford anything now because of Trump's crazy tariffs? So that's one thing. And then in terms of how long it could last, I don't know, but it really is unconscionable, the harm that this administration is causing to regular people. He's just hurting people who can't go to work, who can't get their paycheck. Many families live paycheck to paycheck. They're absolutely being screwed. So he has no regard for the well-being of these families. And he's refusing to allow even Republicans to come back to the table. He's publicly said, shut it down, and he doesn't care how long it's going to last. And it just shows his disregard for working people. We are standing up for working people who need their paycheck, and they are standing against them.
Senator, what about Fort
Senator,
Drum?
is there
This is
anything you
Jeff
can
Cole
tell
from Channel
our
7.
listeners or viewers that they can do so that they have a sense of agency in this?
They should call the White House, and they should call Republican members of Congress to say, get back to the table, lower healthcare costs, stop the attack on working people.
Senator, again, Jeff Cole at Channel 7. Appreciate you taking the time. Fort Drum, soldiers going to work, not getting paid, not getting BAH, right? A lot of soldiers live out in the community. Can you address the situation that soldiers and their families could find themselves in if this goes on for, quite a bit of time?
Well, for our armed services members, many of them, particularly in the lower ranks, they don't get paid a lot of money. They are public servants. They are sacrificing themselves and their careers to make our country stronger. And this administration and the Republicans in Congress are unwilling to value them and to actually pay them. And it's disgraceful. Many of our service members live paycheck to paycheck. Without their BHA, they don't have the basic resources they need for food, for housing, for everything that they need to provide for their family. It's really an outrage.
Senator Henry Rossoff here with Pix 11. Unclear if this is related to the shutdown, but I wasn't sure if you saw the news out of the Office of Budget and Management pulling $18 billion from 2nd Avenue Subway and the Hudson River Crossing Project. I assume they're talking about Gateway there. They cite, quote, unconstitutional DEI principles. Do you know anything about that funding poll? Have you gotten any communication? And do you know if the shutdown is giving them the authority to do this or if it's separate?
They have no authority to do this. What they're doing is total BS, and they're making up lies about DEI. Like, there's no DEI requirements for the Gateway Tunnel. It's an absurdity, and they're just making it up and creating political points that's going to harm New York. So I think it's unconscionable. They have no authority to do this, and we're going to fight as hard as we can in court to get the money back. But this is, again, just President Trump doing what he wants to do with no authority to do it. He's breaking every law, every norm by these kinds of decisions.
Is it tied in any way to that? Are they citing the shutdown as the reason they? I understand you say that's illegal and unconstitutional, but are they citing the shutdown, or is this a totally separate fight that he has picked?
It's a totally separate fight that he's picked, and he's picking it on blue states.
Thank you.
Senator, it's Lowell Rose from 13 WAM News in Rochester. We had some tech issues on our part, but a few questions for you. I know Republicans are calling this a clean bill was to avert the government shutdown, and they're now blaming it on Democrats, calling it a Democratic shutdown. What's your response to that? And also, what do you see as the potential impacts this will have on New York State?
The impacts are horrific. Working people are not going to get their paychecks. We've talked so far today about the troops who will not get their paychecks, will not get their living allowances. We've talked about people who work at the VA. We've talked about people who work at Social Security Administration. Federal employees are public servants that serve our public and help people. And it's total BS that this administration doesn't want to pay them for the work they do every day. And a lot of people, particularly our service members, do live paycheck to paycheck. They don't earn a lot of money. And without these resources, they're going to be in very tough situations. I can't even imagine how many employees will have to consider whether they have to leave a job or get another job because they can't feed their families. It's callous, and it's calculated, and it's designed for political points, and it's complete disregard for the well-being of public servants who serve through the federal government, including our troops. It will hurt New York because a lot of our federal employees, their families live in New York. A lot of the services that our seniors need, that our veterans need, they're going to have a lot of anxiety that those services won't be able to be provided. Millions of people across this country are going to be anxious about whether they can get their Social Security benefits or their VA benefits, or that the flying public will be safe. I mean, all of the types of federal functions, to the extent that anyone's being furloughed at all in these federal functions, it just means less services are going to be provided.
And your take
Senator,
on
can you
Republicans
address the,
calling this
homeless,
a Democratic
situation
shutdown? What's
that
your take on that?
might occur if
Just wait 1 second, 1 second.
Continues
Let me
for
answer
a
just
depth of time?
1 second. WAER, 1 second. I just want to answer the last part of the question. The Republicans are just trying to score political points, but this shutdown is entirely theirs. The Democrats asked for very reasonable requests to get these healthcare costs down, to make sure they don't blow up in our faces, and that people don't have to suffer massive increases in their premiums. And we don't want these cuts to Medicaid to go through. We've come to the table with very reasonable requests, and they're refusing to discuss any of it with us. And so this is entirely on them. It's not government by fiat. The Republicans, it's not their way or the highway. They're supposed to be working on a bipartisan basis. And we have given very reasonable requests of what we want for our constituents, and they're refusing to engage.
Senator, can you talk to the
And last, I would just say, Republicans have all the power. They have the House, they have the Senate, and they have the White House.
Can you talk to the impact of parents that are single households trying to make ends meet, how this will impact them, and how it could also blow up the homeless population if you are hearing that that's the case?
So I missed the first part of your question. Is the question, how will the
I was asking about if you could touch on how the trickle down effect of this is going to impact like single parents in the Syracuse region. We are known for having a very high, we're like the third in the nation for a high level of child poverty. And so I wanted you to address that, if you could, for the single mother households or the single parent households that are depending on SNAP and other programs, rather the Medicaid, Medicare programs. If you could talk about that and how this can impact our homeless crisis situation.
I think it could be devastating for the people that you're talking about. First of all, if their premiums increase, they will not be able to afford health care. When you have a single working parent who can't afford health care for their children, that's an existential crisis for them if they can't keep their child safe, if they can't keep their child getting doctor's appointments that they need. Moreover, a lot of single parents and low-income families are Medicaid recipients. So many of these people will be denied Medicaid because of the Republican bills. And if they do have health care, their premiums will be going up and they might not be able to afford them. So I'm very worried for them from health care. With regard to food and nutrition, the SNAP benefits only last for 1 month. So if this shutdown lasts more than a month, then they won't have access to nutritious food for their families. It'll be a huge problem for food banks and other feeding not-for-profits because they get a lot of resources from the federal government and they won't be able to meet the need. So I'm very worried for the population that you've specifically identified because they are already living hand to mouth. They can't handle another increase in costs. You add to the extreme costs of food and electricity and clothing and healthcare, they just won't be able to afford things. And that means they'll have to cut things that their children need.
Thank you.
Senator, this is Tom Puckett at WBEN in Buffalo. In your opinion, what are some of the other issues that are causing this shutdown?
I think it's government by fiat. The fact that President Trump and the Republican Party will not sit down with us to negotiate a bipartisan funding bill. The fact that they won't listen to their constituents at all about the rising costs in their lives, from food to electricity to clothing to healthcare. The fact that their budget cut millions of people off of Medicaid, and they're just literally unwilling to talk about it. And it's unfortunately, this administration is governing by fear and governing on their own, and that's not what our democracy is based on. It's supposed to be people working on a bipartisan basis to get common sense things done for their constituents, and they won't even talk to us about it.
What will it take to get the Republicans to come to the negotiating table with the Democrats?
I think their constituents need to tell them that they're unhappy with these decisions that they're making. Our democracy always rests on the voice of the people. And so when I hope New Yorkers will call our Republican House members to tell them they're unhappy with this unwillingness to work on a bipartisan basis to get healthcare costs down. It should be the call that everybody makes, and certainly calls to the White House and calls to the administration. And if necessary, we'll have to do protests.
Senator, I was at a press conference with Congressman Langworthy yesterday, and when he was asked directly about the ACA premiums and whether or not they would be willing to discuss that, he had said, quote, "All right, let's get this continuing resolution done. It only goes," I believe he said there was a temporary deal through November. That gives us time to discuss it. And he said, I would be open to those discussions and willing to debate this with them. Now, that's his contention. What would you say to that?
Well, what I would say directly to the congressman is he's full of it. That's not true. These premiums are literally going to rise now. It's happening right now. And we need to have this discussion now to stop these rise in healthcare premiums. We need to have these discussions now about the costs of groceries and housing and electricity and insurance and every other cost that people are paying. And they're just kicking the can down the road. The Republicans control every aspect of government right now. They control the White House, they control the House, they control the Senate, and clearly they control the Supreme Court. And so as a consequence, New Yorkers, constituents, have nowhere to go but to Republicans to say, do your jobs. Just do your job. Stop these rises in healthcare premiums. Stop the cuts to Medicaid. Stop the shutdown where all these federal employees can't work, including our troops, including our first responders, federal first responders. It's unconscionable that they don't understand or respect that people need their paychecks. They can't provide for their families, and they can't allow for these healthcare premium increases to go into effect because it will be entirely unaffordable. So the fact that he's unwilling to do his job now is absurd. Like, get to the negotiating table now. Protect your constituents now. Okay, I've got to go, but if you have more questions, just let our comms team know. Thank you, guys.
Thank you.
Bye.